Okay. Hi, welcome everyone into this virtual space. We wanted to take a moment just to share with you some brief points about a workshop that is offered usually every year through the Graduate Wellness Center on racial microaggressions. And so starting off, just to introduce myself, my name is Dr. Adjoa Osei. I'm a licensed clinical psychologist with a private practice virtually and in Brooklyn. And I also supervise a group within the Wellness Center. And it's my pleasure to be joined with
Hi, yes, my name is Gabriella Robinson, and I am a PhD student at the Graduate Center in Queens College in clinical psychology. And I have the pleasure of being supervised by Dr. Osei here.
All right, so we're going to just share with you just some brief points. We were reflecting on a recent workshop that we did, and we're just going to take a moment kind of to have some dialogue between us. And so, Gabriella, one of the first thoughts that came to my mind as far as with this workshop, kind of who would you say is like the audience for this workshop?
Yes, so I think when we were planning this, we had in mind that it would center students that identify as Black, indigenous, peoples of color. And, we have this idea that there are very few spaces that people of color can sort of have conversations that center, validate, and support the unique experiences that we face. And like the Dr. Osei mentioned, this is a reoccurring workshop that we hope to have every year.
Thank you so much, Gabriella, for just highlighting that, because it is true. I feel like there are so few spaces. And I think anyone who's an ally is welcome to join. I'm sure you can benefit, but to just know that we're really centering and highlighting those experiences of Black, Indigenous people of color.
Yes, and with that in mind, one of the key sort of themes or topics that we talk about are microaggressions. So I don't know if you can define for everyone, what are micro or racial microaggressions, and why is it important to talk about it with graduate students of color?
Sure. I can take a few moments on that. And so the term racial microaggressions was originally coined by psychiatrist Dr. Chester Pierce in the 70s. And he was referring to these kind of subtle, kind of automatic put downs towards Black people. And upon that, Dr. Sue expanded that to think about kind of these everyday slights and put downs and invalidations for people of color that are often within interactions with white people where they may be unaware, sometimes aware, but largely unaware that they've engaged in a way that's like demeaning or offensive to a person of color. And we thought it's really important to talk about racial microaggressions with graduate students because we're often dealing with so many different relationships with your peers, with professors, and also if you're someone who's within the minority in your program, that can be really challenging. And we really, these microaggressions can have a cumulative effect on one's well-being. And so when we think about like macroaggressions, that's kind of more the systemic institutional racism, where microaggressions is not saying that it's like small or insignificant. The micro is really referring to these are things that commonly occur often, and that someone experiences, every day at times. And it can range from something very offensive like racial slurs, and that's very explicit, to invalidating one's experience or a demeaning comment. And it's also important to talk about with graduate students because it can lead to a sense of powerless and hopelessness. You're also dealing with power differentials. So how do we handle if that racial microaggression is coming from a professor or someone in a position of power? It can also have lasting negative reactions and lead to like somatic symptoms. We have headaches, stomach aches, pain. And we're often in this position of this dilemma on kind of how do we respond?
Yes, certainly these are important, topics and issues. And so you mentioned that microaggressions are cumulative. I'm wondering if you can define for us, what is racial battle fatigue?
Yes. And so this definitely goes hand in hand. Racial battle fatigue is a term that was coined by critical race theorist Willem Smith. And it was originally referring to experiences of African American men in America. But now it's kind of been expanded to think about Black, Indigenous people of color and the experience of kind of that race-related stress over time, and how that can affect us mentally, emotionally, and physically. And so these experiences in which we're either being dismissed or invalidated or experiencing insensitive comments can lead to real physical and mood-related symptoms. So we can experience depression, hopelessness. It can raise our blood pressure. We can experience fatigue, headaches. And so that's what the term like racial battle fatigue was thinking about, kind of the cost and the effects of this over time, of racism. And in thinking about that, we've kind of talked a little about racial microaggressions and racial battle fatigue, which we focus on in the workshop. But just in thinking about, Gabrielle, like, what do you hope students would take away from the workshop?
Yes, so we hope that students would take away an understanding of the ways these experiences that you sort of outline here can affect them. Like you mentioned, this could possibly be mentally, physically, and overall, like emotionally, in terms of their overall being. Also, within the actual workshop, we ask students to utilize the cognitive triangle to express their thoughts, feelings, and actions associated with these experiences. And so we hope that that will give them a clearer idea of how to express what was happening to them. Additionally, we hope that they'll become aware of strategies, for addressing microaggressions and, ongoing challenges such as stepping back and educating or developing supportive spaces inside and outside of their program.
Thank you so much, Gabrielle. Yeah, those are the many things that we cover in the workshop, and we hope that people who come are able to, just like Gabrielle said, get some education, also be in a space where you can take care of yourself. And so this workshop is offered usually every year through the Wellness Center. Flyers and emails are sent out throughout your program, and so we hope that at some point you will join us for this workshop.
Yes, thank you.